Welcome to Glow Time with Jackie. It isn't about chasing youth, it's about owning your glow, reinventing your story, and showing up like never before. Glow Time starts now.
Hello, Glow Babes. Welcome to Glow Time with Jackie. I have a special guest here today, Dr. Reincke.
Yep.
She is a confidence booster. She's a badass in scrubs. Dr. Reincke, welcome to the show.
Thank you.
All
Thank
right.
you for having
Of
me.
course. I want to start off with doing a little cheers.
Okay. Mhm.
So let's get our little drinks in. These are adaptogenic drinks. I believe in alcohol-free living. So I cater to these drinks. So cheers to Glow Time with Jackie with Dr. Reincke and Summer Legs. Cheers.
Cheers.
Dr. Reincke, again, thank you for being here.
Thank you for
So let's talk about vein treatment. What causes them and how can we get rid of them?
So the number one risk factor for veins, vein disease, is genetic.
Okay.
One of your parents has vein disease, you have about a 50% chance.
Wow.
And then if both of your parents have it, it goes all the way up to 90% chance. So that's the number one risk factor. Now, there are other risk factors that are kind of contributory and exacerbate if you already have underlying vein disease. So that could be age over 50, multiple pregnancies.
Sure.
For women, our hormones also affect those veins. And basically what vein disease is just big stretched out veins with blood going backwards.
Gotcha. Okay, so question, you said it's genetics.
Mm-hmm.
Is it because women, we expose our legs more? Because I don't really see guys with a lot of vein issues. Is it that they have hairy legs, or is it more that women are predisposed in general to it?
So what I would tell you is it's about 60%, 40%.
Okay.
60%.
This is still a lot of men.
It is a lot of men.
Wow.
What I've seen in the last 10 years practicing is this. Women will present a little earlier in their disease course, maybe not in their age, but in their disease course, because they have veins that are visible. Men tend to present a little later in the course of vein disease, so they might have skin changes, a vein that bleeds,
Gotcha.
a wound that doesn't heal. So it's really pretty close, actually, in terms of male-female patients.
Right.
I think it's much more so. That's kind of one of those things that I try to do outreach and education about.
Okay.
It's not just a female disease.
Okay, yeah, it's good to know because that's kind of a misconception.
It is.
So tell me a little bit about treating it. So
Okay.
I know my legs, I have a couple of veins. I have some little small veins, and then I have like one little dark kind of ropey vein a little bit higher.
Okay.
So tell me about how you treat the differences between the two, and then how you treat them.
Okay. So the biggest thing when patients come in that I try to separate out, I'm going to kind of siphon this out, is do you have symptoms or you don't have symptoms?
Gotcha.
Right? If you have symptoms and you have veins that bother you, whether that be they're tender, bulging, itching, etc., then that becomes a medical issue.
That's you have a symptom. You have symptoms.
Correct.
Gotcha.
And then that would be treated medically.
I see.
Typically covered by insurance. Most commercial plans will cover that.
Gotcha.
However, if it's just that you don't like the way veins look, that's completely aesthetic. It's cosmetic, and it is not covered by insurance. Your treatment options, if it's medical, I'm going to close those veins down. So think of big veins. This is under the skin. These are not just the visible ones. I treat them with either catheter and heat. This procedure's done in the office.
Gotcha.
No downtime. You're back to your normal activity.
Really?
Yeah.
Even working out?
Yes.
Oh, wow. Okay.
Yes. Yep. Same day. No downtime. Or so I either use a catheter, or I'm going to use an FDA-approved foam injection, and those would be for some of the more branching vessels. Again, these are not what you see visibly on your skin.
I see.
It's just underneath the skin.
Okay.
Cosmetic, if we're shifting to that,
yeah,
totally different, right? Not covered by insurance, cash patients, or the procedures are cash. And then it's just, for me, I use tiny little needle and injection of a chemical that helps to destroy those veins. And then over time, your body will absorb them.
I see.
It's not one and done, though. So I think that's really important in either case. These are treatments. They're not a cure.
Right. Okay. So when you say that about the cosmetic,
Yes.
of course, we're going to notice it more on the surface, but what are some of the symptoms? Like, I know you mentioned a little bit, but let's say, is it possible that the small little veins do have symptoms, but we just haven't put the two and two together to say, oh yeah, I have like this discomfort at night. I feel like I have to elevate my feet and all that. So tell me a little bit about that.
Okay. Yeah. One thing that I always, of course, listen to patients. I'm never going to negate what they tell me. But what I would say to them is sometimes people don't realize they have symptoms.
Right.
Because vein disease is just slow and progressive. So this is over years. This happens over 10, 20, 30 years. And it's like they develop a tolerance to it, like you can to other things.
Right.
So they might not really think that they have symptoms, but like you said, it might be the end of the day and they're lifting up their legs and they may not even consciously be realizing, right?
Mm-hmm.
That it's because it makes them feel better. So certainly there are times before patients are treated where they think they have no symptoms, but I can look at their legs and tell by maybe skin changes, skin discoloration, bulging veins, etc. I can tell them 100% you have vein disease.
Okay.
And it could be treated.
Okay.
And I might offer them sort of slow treatment where I treat just one vein and see if it helps.
Mm-hmm.
And they may get enough symptomatic relief that they're like, oh, wait, now my right leg feels better if I'm treating that leg.
Right.
And I can tell there's a difference.
Okay.
So yes, it is
very interesting.
Mm-hmm.
Very interesting. So with the essence of the show,
yes,
tell me how this becomes like when they get their veins treated, it becomes a confidence booster. Or tell me how women come in when they're just discouraged. They don't like the way they look. They don't like their veins. They don't want to put shorts on. Like, tell me a little bit about that. How do their lives change?
I think just what you said in terms of confidence. So people have this fear. It's interesting. I do this quality of life survey before they even get treated. And oftentimes one of the things that I'm assessing for is how much does it affect how you feel about yourself?
Right.
Right. Even if it's medical, I still want to know. And many times they're checking that 1 to 5, they're checking a 5.
Mm-hmm.
So it might be they have all these symptoms, but they also don't like the way they look. They're embarrassed.
Yeah.
I do hear that. I won't wear shorts. I don't even wear dresses anymore. It's not my primary thing that I'm coming in for, but I still don't like the way they look.
Right.
And so, yeah, it affects how they move throughout their life, I guess.
Right.
And I'm certainly not there to tell them that this is going to be some magic act, like I'm going to treat you medically and all those are going to go away. No. But I think in making their legs feel better, now maybe if they couldn't or wouldn't go to the gym.
Yeah, absolutely.
They're getting back in, they're exercising.
You don't feel well or you don't look good, you're not going to feel well.
Yes.
It's just a mental thing. Like you want to be confident. So especially in Houston, like a lot of times we have to wear shorts.
Yes, right? Yeah.
We have to wear shorts. Even the dresses, long dresses, they make your legs sweaty.
Yes.
Like it's hot. It's hot in Houston. You either have to almost wear shorts. You don't want to be in tights all the time. You definitely don't want to be in pants unless you absolutely have to. So I can definitely see how that's leg therapy is definitely a confidence booster.
Yes.
So let's talk about busting myths.
Yeah.
Okay.
Mm-hmm.
So is this just for grandmas, quote unquote grandmas?
No. That's why I try to do. So the focus in my practice is education. Whether I treat you or not, that is not, when patients come in, that's not necessarily my goal. My goal is listen to a patient, put their whole history, physical exam together, and then educate them about the vein disease. Yeah. It's fine. If you aren't at a point where you can or you want to get treated, let me just talk to you about this.
Sure.
So if you get to the point in the future, you could get treated. In terms of myths, it's not just an old person's disease.
Right.
That's one thing. Usually symptoms will start for people, probably the average age is in the 40s.
Wow, yeah.
Men or women.
And that's super young.
I agree.
That's young.
It's really young.
Yes.
I'm 55, so that's really young.
Look fabulous.
Y'all are babies. So that's one myth. Another is the male-female thing, that it's just female.
Right.
That it's just cosmetic. There's no medical issue, underlying issue. That's another myth. I think a little bit about age, but some people, even in their 20s, have this disease. The youngest person I ever took care of was a 21-year-old professional boxer here in Houston.
Oh, okay.
He had huge, big varicosities. And for the longest time, people just kept sort of dismissing it.
Right. Because he was young, probably. They're like, oh, you have time.
Yeah. And
You don't have to treat it.
Yes. The boxing commission came in and told him, until you get that treated, we're not going to let you box anymore.
Wow.
So that's kind of another myth as well.
Would you say, do you see it in because I've seen a couple like young athletes, or anytime that there's been trauma, like say that they, so I'll say for me, there's a little area in my ankle, and it came about after I had laser tattoo removal.
Yes.
And it was just some trauma that then caused the little varicose, like telangiectasias there in that area.
Correct. So that is another thing that can exacerbate. It doesn't cause the vein disease, right? But of those things, obesity, trauma, recent injury, surgery, female hormones, estrogen and progesterone, those are all things that can exacerbate an underlying issue. Yes.
Wow. Okay, so tell me about like working out. Does working out make it better? Does it exacerbate? Like, tell me a little bit about that.
What I would tell you is it doesn't exacerbate it. It probably makes it better in the sense that, think of you're in there, you're exercising, you're helping your physical,
as
well as your mental,
bringing down the obesity.
Yeah. Yes.
Right? Bringing that down to your most stable weight.
Yes.
Yeah.
Yeah, that's really important. It's not about a number, but just about physically feeling better, mentally feeling better. So yeah, all my patients, I tell them at a minimum, try to do dedicated walking. If nothing else, it could be a treadmill, it can be outside, whatever works for you, in a mall. But yes, exercising is great, because what it does is when you're exercising, you are contracting your leg muscles. You're forcing blood the correct way. Remember, blood's going the wrong way with this disease. So you're forcing blood the correct way.
Okay.
And at least temporarily, you're relieving some of that pressure.
Right.
So I definitely, my patients walk out of my office the same, like it takes me about 15 minutes to do a heat-based procedure and a catheter-based procedure. And they're back to their normal activities immediately. And I tell them, go walk for 15 minutes.
That's amazing. So walk me through just a quick little, procedure. Like say the catheter procedure. I come into your office, I see your beautiful face, and you're like, lay down, I'll take care of you.
I'll take care of you.
And so I'm there. Do you put topical cream on there?
Both.
Okay.
So what I do, I actually use a freezing spray first. I use ultrasound. I find the vein that's big and juicy and has backward blood flow on the ultrasound.
And your eyes get really big and you're just like so excited.
Yes, I love veins.
It's your therapy.
Yeah, oh, it is. So big veins, ultrasound, cold numbing spray. Then I use tiny needle. And I use a local. So the cold numbing spray takes away the pinch of the tiny needle, right? I use topical. Make a small cut. It's probably, what I tell my patients is, it's no wider than my pinky nail.
Gotcha.
And that's what I use to work through. I put the catheter through that, put it inside the vein, lots more numbing all around the vein. And then I'm going to activate the catheter, and it's going to heat, and it's going to seal the vein down. Blood will get rerouted immediately. We get it going back towards the heart. The catheter comes out. The vein stays in. What happens over time really is that your body just takes that vein that's now heated and sealed. That's called an ablation. And it is going to form that into like a scar inside your leg. And then I tell my patients, these little Pac-Men over time are just going to chew up that vein. And those are enzymes. So normal enzymes, which are the Pac-Men, are just going to break down that vein, and it will dissolve over time.
Gotcha. So you actually just treat the vein, but your body is really what breaks it down and makes it completely go away.
That is correct.
Yeah.
Yeah.
Okay. Very interesting.
Yeah. It's a great procedure. Like 30 years ago, I was a surgical ICU nurse. This is how I started out my career. And I worked in a open heart and transplant unit. And we used to sometimes get those patients that would have a vein stripping procedure.
Oh yeah, I heard about that.
Yeah. And that was general surgery, anesthesia.
They took the vein out.
Yeah, they stripped it out.
Wow.
And that was a 6 weeks recovery time. So for me professionally, I've kind of seen it come full circle.
Yeah,
where
that's
when
amazing.
I was a nurse, yeah, we would sometimes, if those patients were in a lot of pain. And what I would find is the patients that had vein stripping were in more pain than the patient that had open heart surgery with that median sternotomy.
Wow.
Yeah. So
Yeah.
it's nice to be on this side.
Yeah, it definitely.
Yeah.
And it's nice to see like the advances in technology, obviously.
Yeah.
And just that, because I'm sure back then it was older people that got treated.
That's correct.
It wasn't like for the young per se. It was, this is something that you're at this age and this is now what your next step is in getting treatment.
Correct.
All right.
Yeah.
And so tell me, I know we touched a little bit on it, but how can we prevent these how can we prevent the vein therapy? And then tell me, is there preventative? Like, is there a way that we can prevent the treatment, the veins from even happening? If we know that like our mom has it, our dad has it, so we are predisposed to getting it, how can we help prevent the veins from happening?
The short answer to that is you can't.
Okay.
There's no prevention for vein disease.
Wow.
If you have it, you have it. What you can do, though, is you can slow down the progression.
Okay.
So imagine this is how I educate my patients. Imagine that you have this train, and the train is always moving, right? But it's moving much faster if you don't exercise regularly,
Right.
don't hydrate your body with water.
Right.
If you are obese, if your hormones are not aligned, if you have an occupation where you sit or stand a lot. And of course, everybody has to, work or et cetera, do things that they want to do in their daily activities, but standing a lot, sitting a lot, those kinds of things, if you can minimize or just be aware.
Yeah.
Right. So there's no prevention for vein disease.
Interesting.
But you can slow down the progression
Sure.
by exercising, modifying your diet, drinking plenty of water, even wearing compression hose.
I was going to ask about that.
I think it's great if you can. We live in Houston.
I know.
It's super hot. Nobody wants to wear them. So here's what I am. I'm real. I'm like legit.
Yeah.
When I talk to my patients, I say, tell me if you're not going to wear them, let's not play games.
Right.
Okay?
Yes. Let me know.
I'm a straight shooter. So most of them won't. And I respect it. I'm not going to try to get my patients to do anything they won't. But if you can wear them, awesome. If you can't wear them, then do things like if you're working, you could easily put your feet maybe up on a box at work under your desk, or get up every hour and walk around your desk, right? At the end of the day, elevate your legs, drink plenty of water. So those are some ideas.
Yeah, we'll wear our compression socks the one day in January that it gets cold.
Yes, just that day.
And then we forgot them at home because it was hot in the morning.
Yeah.
And just like a cold front came in.
Yeah.
What about crossing your legs? Because I cross my legs a lot, all the time. And when I cross my legs, I think of, the veins are forming. The veins are forming. We can't, it's just almost like.
I think that is probably just a little bit of, they're already there. I mean, if that's the worst thing that you do, you're good.
Okay, so
You're
I
good.
can just not worry too much. Just do all the other things. Exercise.
Please. Yes.
Drink
plenty
water,
of
all the
water.
good things,
Yes.
all the good things that are going to help you from the inside out.
Right.
And just continue doing that to really help, quote unquote, slow down the process. Because it's not going to prevent. That's a good thing, because I need to keep that in mind, because I'm thinking, what can I do? And it's just slowing down the process. So when it happens, I come and see you.
Of course.
Yeah. And where can we find you?
My office, I have one office, Sugarland.
Awesome.
Yep. In Sugarland. That is all I plan to ever have.
Okay.
This is my solo location. I previously had, under a different name, I had 3 locations in Houston. They were sort of triangulated.
Yeah.
I had physicians working for me, but it wasn't the best model for me personally or professionally, meaning I really want to have one-on-one care with my patients. It's really important to me. And I wasn't able to do that. And so I kind of had to sit down. What do I want?
Right.
And then manifest something else.
Absolutely. Yeah. Reinvent yourself.
I did.
Yeah. Reinvent yourself. And if you want to be hands-on.
I do.
You want to give the patient that education. You really want to teach them how to do it, what needs to happen. It's a process. It's not just going to be a one-time thing.
Never.
And that goes a long way.
What it does is it sets expectations.
Yeah.
And what I find is that even people that I don't treat, so let's say, somebody comes in and I think that that is not their chief complaint. They might have vein disease.
Mhm.
But I say, no, I'm not going to treat you because I think what you're telling me, what I'm hearing you say is I'm making this up, sciatica, or you actually need to go see an orthosurgeon,
Right.
or, right? Even those patients appreciate so much that
Yeah.
they were educated but turned away.
Yeah.
And that is a win for me.
Yeah, because that makes me trust you. I
hope
trust
so.
you 100%.
That's all I
That's
have.
because I trust you because you're telling me what's in my best interest.
Yeah.
And it's not just about, getting me on the schedule, just doing the
Yeah.
procedure. You're actually, you have intention to help me. That's
Yes.
awesome.
You know what that's called? A patient advocate.
Yeah.
And that started a long time ago for me. So I wanted to stay true to that.
Yeah.
And I'm able to do that. And I love my job. I go
That's-
to work every day. I'm like,
Yay. Awesome.
Yeah.
That's fabulous.
Yes.
Well, thank you for being on the show.
Thank you.
Thank you for informing us. Thank you on how to, teaching us how to have the glow legs, beautiful summer legs.
Yes.
So on that note, let's take a little cheers to summer legs.
Cheers.
Thank you for being on the show.
Thank you.